You're in good hands here at Osmosis because we care about each other and our learners. Bad puns aside, urine is an important way for us to eliminate waste, and it takes quite the journey from the kidneys to the outside world. Let's look at the path of urine after it leaves the kidneys and the structures it passes through along its journey. After exiting the kidney, urine travels through 3 main structures before leaving the body: the ureters, the urinary bladder, and the urethra. Let's start with the ureters, which are paired muscular tubes sitting retroperitoneally that transport urine from the kidneys to the urinary bladder. The ureters are roughly 30 centimeters long and have 2 parts: an upper abdominal part and a lower pelvic part. The abdominal part starts at the kidneys and descends in the abdomen posterior to the peritoneum to reach the pelvic brim. Here, the ureters cross near the bifurcation of the common iliac arteries, where the external and internal iliac arteries begin, and are now referred to as the pelvic ureters. The pelvic ureters run on the lateral walls of the pelvis, reaching the ischial spines. Then, each pelvic ureter passes anteromedially to enter the posterior wall of the urinary bladder. Now, the ureter is surrounded by many structures that differ between biologically male individuals and biologically female individuals. In males, the ureters enter the posterior wall of the bladder superior to the seminal vesicles, which are paired glands that secrete parts of the seminal fluid. Also, the ureters run posterior to the ductus deferens, which are paired tubes that carry sperm from the scrotum to the pelvic cavity. The ductus deferens emerges from the inguinal canal and travels to the posterolateral angle of the bladder, where it passes superior to the ureter. In females, the ureters pass medial to the origin of the uterine artery. Then, at the level of the ischial spine, the uterine artery crosses the ureter. Finally, the ureters run near the lateral part of the upper vagina and enter the bladder. When the ureters enter the urinary bladder, they travel in an inferomedial direction to drain into the bladder in an oblique orientation. This oblique orientation creates a one-way valve, preventing urine from going back up the ureters. As the bladder fills with urine, the internal pressure increases, which compresses the part of the ureter that's embedded in the bladder wall. Also, during micturition, which is a fancy way to say when peeing, the bladder wall contracts, closing off the lumens of the ureters where they enter the bladder in a sphincter-like fashion, clamping them shut to also prevent reflux of urine into the ureters. Okay, now the arterial blood supply of the ureters is segmental, meaning that each segment receives blood from different arteries. Within the pelvis, the pelvic ureters are supplied by branches from the internal iliac artery, such as the superior vesical artery, while the terminal parts of the ureters are supplied by the inferior vesical arteries in males and the vaginal and uterine arteries in females. Venous blood from the ureters is drained by veins that follow the arteries, and lymphatic vessels carry the lymph to the common iliac and internal iliac lymph nodes. Finally, the ureters are innervated by nearby autonomic nerve plexuses, including the renal, aortic, and the superior and inferior hypogastric plexuses. The ureters lie above the pelvic pain line, meaning that afferent pain fibers travel with sympathetic nerves to the T10 to L2 spinal segments. Alright, now that we know all about the ureters, let's look at its next stop, the urinary bladder. The urinary bladder is a hollow organ that temporarily stores urine before micturition. The urinary bladder sits posterior to the pubic bones and the pubic symphysis. In males, the bladder is anterior to the rectum and superior to the prostate. And in females, its posterior surface rests on the anterior vaginal wall. In adults, an empty bladder lies in the lesser pelvis, posterior, and slightly superior to the pubic bones. Now, as the bladder fills with urine, it extends superiorly and ascends into the greater pelvis. In some individuals, a full bladder may even reach the level of the umbilicus. Before we learn more about the bladder, let's first look at some of the surrounding structures and how the parietal peritoneum creates folds around the bladder. If you recall, the abdominal cavity is lined by parietal peritoneum, which extends inferiorly into the pelvis and reflects over some pelvic viscera, such as the urinary bladder. These reflections form peritoneal folds that vary between males and females. Let's start by first looking at the peritoneal folds in males. First, the peritoneum descends on the anterior abdominal wall and reflects over the superior surface of the bladder. Here, it loosely attaches to the superior surface of the bladder, creating a small triangular space called a supravesical fossa. Then, the peritoneum continues over the superior surface of the bladder and extends laterally to cover the lateral walls of the pelvic cavity. This creates a space on each side of the bladder called the paravesical fossa. To remember this, para means beside and vesicle means bladder. So these fossae are beside the bladder. The peritoneum continues posteriorly to cover the posterior wall of the urinary bladder. Here, the peritoneum crosses the distal parts of the ureters and the ductus deferens on each side, creating paired peritoneal folds called the ureteric folds. Next, due to the bladder being positioned anterior to the rectum, the peritoneum leaves the posterior surface of the bladder and reflects over the anterior surface of the rectum, which creates a sac between the bladder and the rectum called the rectovesical pouch. This pouch extends laterally and posteriorly, forming a fossa on each side of the rectum called the pararectal fossa. Finally, the peritoneum ascends to cover the anterior surface of the rectum before engulfing the sigmoid colon. Alright, now in females, the peritoneum travels in a similar fashion as it does in males, with the main differences coming near the posterior surface of the urinary bladder as the bladder sits anterior to the uterus. Here, the peritoneum reflects over the anterior surface of the uterus, reaching the uterine fundus. This creates a space between the bladder and the uterus called the vesicouterine pouch. Now the peritoneum covering the anterior surface and the fundus of the uterus extends laterally, forming a double peritoneal fold called the broad ligament of the uterus, which keeps the uterus in position. This ligament also covers the uterine tubes and suspends the ovaries. Okay, now let's take a deep breath and have a quick quiz. Can you name these structures? Alright, now an empty bladder has an apex, body, fundus, and neck, as well as 4 surfaces: superior, posterior, and 2 inferolateral surfaces. The apex of the urinary bladder points anteriorly towards the pubic symphysis, and it's connected to the umbilicus by a ligament called the median umbilical ligament. The fundus, on the other hand, lies opposite to the apex and forms the convex posterior surface of the bladder. Next is the body, which lies between the apex and the fundus and makes up most of the urinary bladder. Finally, the fundus and the 2 inferolateral surfaces meet below to form the neck of the bladder, which continues inferiorly with the urethra. Now the bladder lies mostly free within the lesser pelvis, except for its neck, which is fixed by ligaments. These ligaments are the lateral ligaments of the bladder, the puboprostatic ligament in males, and the pubovesical ligament in females. The lateral ligaments of the bladder extend from the neck of the bladder and blend with the pelvic fascia. In males, the puboprostatic ligament extends from the prostate to the pubic bones. In females, the pubovesical ligament extends from the neck of the bladder to the inferior part of the pubic bones. Now let's zoom into the wall of the urinary bladder, which is mainly formed by a muscle called the detrusor muscle. This muscle contracts to increase the pressure inside the bladder, which leads to urination. The muscle fibers of the bladder wall thicken as they reach the neck, forming an involuntary circular muscle called the internal urethral sphincter. This muscle surrounds the opening between the neck of the bladder and the urethra, called the internal urethral orifice. The internal urethral sphincter contracts and constricts the orifice, which helps maintain urinary continence. In males, it also contracts during ejaculation to prevent retrograde ejaculation of semen into the bladder. Now let's look inside the urinary bladder, which has irregular folds of mucous membrane called rugae. These rugae are best seen when the bladder is empty, because as the bladder fills, they begin to stretch and fade away. Inside, the posterior wall of the urinary bladder has a smooth triangular area that doesn't contain rugae, even if the bladder is empty, called the trigone of the urinary bladder. The base of this triangle is formed by an imaginary line that connects the openings of the ureters, called the ureteric orifices. The apex of the trigone points downwards and is formed by the internal urethral orifice. Alright, now let's look at the blood supply of the urinary bladder. First, the arterial blood supply of the bladder comes mainly from branches of the internal iliac artery. In both male and female individuals, the superior vesical arteries supply the anterior and superior parts of the urinary bladder. In males, the inferior vesical arteries supply the lower parts of the urinary bladder, such as the neck and the fundus. In females, the vaginal artery supplies the posterior-inferior parts of the urinary bladder instead of the inferior vesical arteries. Finally, the obturator and inferior gluteal arteries send small branches to supply the urinary bladder. The venous blood of the bladder drains into a network of veins called the vesical venous plexus. In males, this plexus connects with the prostatic venous plexus, and these two plexuses surround the fundus of the bladder, the prostate, the seminal glands, the ductus deferens, and the lower part of the ureters. In females, the vesical venous plexus communicates with the uterovaginal venous plexus and surrounds the neck of the bladder and the upper part of the urethra. The vesical plexus often drains into the inferior vesical veins, which drain into the internal iliac veins. The vesical venous plexus may also drain into the sacral veins, which drain into the internal vertebral venous plexus. The lymphatic drainage of the superior and lateral surfaces of the bladder drain to the external iliac lymph nodes. The drainage of the neck and the fundus of the bladder drain to the internal iliac, sacral, and common iliac lymph nodes. So we know that our bladder stores urine, but what happens when it's full? Typically, we have voluntary control of our bladder. However, our bladder is also controlled by autonomic pathways which can prevent or cause urination through the micturition reflex, where autonomic control is a balance between parasympathetic innervation and sympathetic innervation. The urinary bladder receives input from the sympathetic and parasympathetic divisions of the autonomic nervous system. The sympathetic fibers originate from the lower thoracic and upper lumbar regions, and these fibers travel through the superior and inferior hypogastric plexuses before reaching the bladder. Sympathetic innervation causes relaxation of the detrusor muscle and contraction of the internal urethral sphincter to retain and store urine. Remember, sympathetic innervation is our fight or flight response. So if we are running away from something, we don't want to be voiding our bladder, even though I'm sure this would scare away whatever is chasing us. It is also important to note that in males, sympathetic innervation is responsible for ejaculation and to prevent semen from entering the urinary bladder during ejaculation, which is called retrograde ejaculation. These fibers again cause contraction of the internal urethral sphincter. Next are the parasympathetic fibers, which originate from the sacral segments of the spinal cord. These fibers travel through the pelvic splanchnic nerves, reaching a network of nerves called the inferior hypogastric plexus. When the bladder fills, it begins to stretch, and if it reaches the threshold, it can activate the micturition reflex by sending a signal along visceral afferent fibers. This stimulates the parasympathetic fibers, which causes contraction of the detrusor muscle and relaxation of the internal urethral sphincter, facilitating urination. Parasympathetic innervation is also responsible for erections in males. And the mnemonic point and shoot can help you remember that. Point, or initiating an erection, is parasympathetic, and shoot, or ejaculation, is sympathetic. The final component of the micturition reflex is voluntary control of the external urethral sphincter. In males, the external urethral sphincter lies inferior to the prostate gland, and in females, it lies just inferior to the internal urethral sphincter. We have voluntary control over this muscle through branches of the pudendal nerve, allowing us to choose when to void our bladder. One last thing about the innervation of the bladder. The upper part of the urinary bladder lies above the pelvic pain line, which means that pain fibers that come from the upper part travel with the sympathetic fibers to the inferior thoracic and upper lumbar segments of the spinal cord and to the brain. The lower part of the urinary bladder lies below the pelvic pain line, which means that pain fibers that come from the lower part travel with the parasympathetic fibers to the sacral segments of the spinal cord. Okay, now let's take a deep breath and have a quick quiz. Can you name this muscle? Okay, can you name this ligament? Now let's move on and talk about the urethra, which is what transports urine from the bladder to be excreted. The urethra differs between males and females, so let's start with the male urethra, which is a muscular tube that measures roughly between 18 and 22 centimeters long. This tube begins at the internal urethral orifice in the bladder and ends at the external urethral orifice in the glans penis, and forms a common passage for urine and semen to leave the body. The male urethra actually has 4 parts: an intramural or preprostatic part, a prostatic part, an intermediate or membranous part, and lastly, the spongy urethra. First is the intramural or preprostatic part of the urethra, which extends through the internal urethral sphincter before entering the prostate gland. Next is the prostatic part of the urethra, which is the widest and most expandable part of the male urethra and travels through the prostate gland. Now, the prostatic part of the urethra is unique from the others, so let's take a closer look inside. The posterior wall of the prostatic urethra has the urethral crest, which is a longitudinal elevation that lies in the midline. This crest has grooves on each side called the prostatic sinuses. These sinuses have many small openings for the prostatic ducts, which carry secretions from the prostate gland into the urethra. The urethral crest extends inferiorly, forming a rounded eminence called a seminal colliculus. This eminence has a small, slit-like opening that leads into a small empty sac called the prostatic utricle. Finally, on each side of the prostatic utricle are the openings of the ejaculatory ducts, which are paired structures, each formed by the union of the ductus deferens and the duct of the seminal gland. So in this part of the prostatic urethra, the urinary and the reproductive tracts merge. Next is the intermediate or membranous part of the urethra, which is the narrowest and the least expandable part of the urethra and penetrates the perineal membrane, which is a thin, horizontal membrane in the perineum. This part is surrounded by circular folds of voluntary muscle fibers called the external urethral sphincter, which, if you remember, is the sphincter under voluntary control. Last is the spongy urethra, which is the longest and most mobile part of the urethra. This part passes through the penis and measures about 15 centimeters in length. 2 P-shaped glands, called the bulbourethral glands, open into the bulbar part of the spongy urethra through the bulbourethral ducts. These glands contribute to the seminal fluid by secreting a lubricating fluid during sexual arousal prior to ejaculation. Like the ureters, the blood supply of the male urethra is also segmental. The intramural and prostatic parts get their blood supply from branches of the inferior vesicle and middle rectal arteries, which are branches of the internal iliac artery. Next, the membranous and spongy urethra are supplied by the dorsal artery of the penis, a branch of the internal pudendal artery. The venous drainage of the urethra mirrors the arterial supply. Lastly, the male urethra receives autonomic sympathetic and parasympathetic innervation from branches of the prostatic nerve plexus, which is derived from the inferior hypogastric plexus, in addition to somatic innervation provided by the pudendal nerve. Now let's switch to the female urethra, which measures roughly 4 centimeters in length. This tube starts at the internal urethral orifice of the urinary bladder and travels antero-inferiorly, passing posterior and inferior to the pubic symphysis. From here, it travels through the pelvic diaphragm, external urethral sphincter, and perineal membrane. Finally, it ends at an opening called the external urethral orifice. This orifice lies anterior to the vaginal opening in the vestibule of the vagina, which is the space between the two labia minora. Finally, in the walls of the distal urethra are paired glands that secrete mucus during sexual intercourse, called the paraurethral glands. The blood supply of the female urethra comes from the internal pudendal and vaginal arteries. The venous drainage mirrors this arterial blood supply. Finally, the female urethra is innervated by branches of the vesical plexus and the pudendal nerve. Alright, as a quick recap, let's follow the path of urine and the organs it passes through along its way. First, the urine exits the kidneys into the ureters, which carries it to the urinary bladder. The ureters descend retroperitoneally in the abdomen and eventually enter the pelvis, where they drain into the posterior surface of the urinary bladder, forming a one-way valve that prevents urine from flowing back into the ureters during micturition. The pelvic portion of each ureter is mainly supplied by the inferior vesical artery in males and the uterine artery in females. The venous blood of the ureter drains into the vesical venous plexus and the internal iliac veins. Urine then enters the urinary bladder, which is a hollow organ that stores the urine before micturition. It lies in the lesser pelvis, posterior and above the pubic bones, and can extend up to the umbilicus when full. The wall of the bladder is mainly composed of the detrusor muscle. The bladder and surrounding structures are covered by parietal peritoneum, which extends inferiorly from the abdominal cavity to cover the superior and lateral surfaces of the urinary bladder and pelvis, forming different folds and fossae. The bladder lies free within the lesser pelvis, except for the neck, which is fixed by the lateral ligament of the bladder, the puboprostatic ligament in males, and the pubovesical ligament in females. The upper part of the urinary bladder is supplied by the superior vesical arteries, and the lower part is served by the inferior vesical arteries in males and the vaginal artery in females. Once the bladder is full enough, micturition is initiated through the autonomic pathways of the micturition reflex and the voluntary relaxation of the external urethral sphincter. Urine is carried from the urinary bladder to the exterior in a tube called the urethra. The male urethra has 4 parts, measuring up to 22 centimeters in length: preprostatic or intramural, prostatic, membranous, and spongy parts. The female urethra is much shorter than the male urethra, measuring about 4 centimeters long. It runs inferiorly through the pelvis, parallel to the vagina, and ends at the external urethral orifice. The male urethra receives arterial blood from the inferior vesicle and middle rectal arteries and the dorsal artery of the penis. It is innervated by branches of the prostatic nerve plexus and pudendal nerve. Finally, the female urethra receives arterial blood from the internal pudendal and vaginal arteries and is innervated by the vesical plexus and the pudendal nerve.
The perineum is a diamond-shaped area and shallow chamber of the pelvis that lies below the pelvic diaphragm. At first glance, it may seem like a small and insignificant area, but it actually plays a key role in micturition, defecation, intercourse, and delivery by supporting the urinary, gastrointestinal, and reproductive organs of the pelvis. Now, let's start with the outer surface of the perineum, called the perineal region. This region is shaped like a diamond that extends posterolaterally from the inferior surface of the pubic symphysis to the ischial tuberosities laterally, bounded by the inferior pubic and inferior ischial rami anterolaterally. From the ischial tuberosities, it continues posteromedially to the sacrum and coccyx, bounded by the sacrotuberous ligaments posterolaterally. This diamond is divided into two triangles by an imaginary transverse line that extends from the two ischial tuberosities. These triangles are called the urogenital triangle, which lies anteriorly, and the anal triangle, which lies posteriorly. Now, in the middle of the imaginary line that connects the ischiopubic rami lies an irregular mass called the perineal body. This mass forms the central point of the perineum and is a meeting point for many muscles, including the superficial transverse perineal muscles, deep transverse perineal muscles, levator ani, bulbospongiosus, external anal sphincter, and external urethral sphincter muscles. Alright, now deep to the skin of the perineal region, there's the perineal fascia. This fascia has two layers, the superficial perineal fascia, or Colles fascia, and the deep perineal fascia. The superficial perineal fascia also has two layers, a superficial fatty layer and a deep membranous layer. The superficial fatty layer differs between females and males. In females, the fatty layer forms the substance of the labia majora, which are the larger folds of the vulva, and the mons pubis, which is the rounded mass that lies anterior to the pubic symphysis. In males, the fatty layer extends into the penis and the scrotum. In the scrotum, it is replaced by a thin layer of smooth muscle called the dartos muscle. In both males and females, this fatty layer continues above with a fatty layer of the superficial abdominal fascia in the lower part of the anterior abdominal wall, called Camper fascia. The superficial fatty layer also continues posteriorly with a fatty mass that surrounds the anal canal, called the ischioanal fat pad. Next, the superficial perineal fascia, also called the Colles fascia, has a deep membranous layer which has many attachments to nearby structures. Posteriorly, it attaches to the posterior margin of the perineal membrane in the perineal body, meaning this layer doesn't extend into the anal triangle. Laterally, it attaches to the deep fascia of the upper and medial sides of the thigh, called the fascia lata. The anterior attachment differs between females and males. In females, the deep membranous layer and the superficial fatty layer extend into the labia majora. In males, it connects with a layer of connective tissue in the penis and the scrotum, called the dartos fascia. Finally, in both females and males, the deep membranous layer continues above with the membranous layer of the superficial abdominal fascia in the lower part of the anterior abdominal wall, called scarpa fascia. Alright, now let's discuss the deep perineal fascia, also called the investing fascia, which lies beneath deep to the membranous layer of the superficial perineal fascia. This layer surrounds the ischiocavernosus, bulbospongiosus, and the superficial transverse perineal muscles. In both males and females, this layer attaches laterally to the ischiopubic rami. This fascia is also continuous with many supportive structures in both females and males. In females, it continues anteriorly with a ligament that supports the clitoris, called the suspensory ligament of the clitoris. In males, it continues with a similar ligament that supports the penis, called the suspensory ligament of the penis. Finally, the deep perineal fascia continues above with the deep fascia that invests the muscles of the abdominal wall. Okay, now let's take a deep breath and have a quick quiz. Alright, can you name this fascia? Now, let's switch gears and explore the urogenital triangle. The urogenital triangle is covered by a sheet of fascia called the perineal membrane that extends between the ischiopubic rami. This membrane fills the urogenital hiatus, which is the gap in the anterior part of the pelvic diaphragm. In both males and females, this membrane is perforated by the urethra. In females, it is also perforated by the vagina. Finally, the perineal membrane and the ischiopubic rami form a foundation for the male and female erectile bodies, which lie in the superficial part of the urogenital triangle. Within the urogenital triangle are the perineal pouches, which are two spaces or compartments called the superficial and deep perineal pouches, separated by the perineal membrane. Let's start with the superficial perineal pouch, which lies between the perineal membrane and Colles fascia. The contents of this pouch differ between females and males. In males, this pouch contains the root of the penis, which has two parts, the bulb and the crura of the penis. The bulb of the penis lies in the midline, and the crura of the penis lie on each side of the bulb. Each of these parts is associated with one of the superficial muscles of the perineum. The bulbospongiosus muscles cover the bulb of the penis, and the ischiocavernosus muscles cover the crura. The superficial transverse perineal muscles also lie within the superficial perineal pouch and extend from the ischial tuberosities to the perineal body. Now, in the female urogenital triangle, there are multiple erectile structures. First, there's the clitoris, which also has paired erectile structures called the crura of the clitoris. Next are the bulbs of the vestibule, which are paired erectile structures that extend posteriorly from the clitoris, lateral to the urethra and the vagina. Also in the superficial perineal pouch, there are the greater vestibular glands, which are two pea-sized glands that lie posterolateral to the vaginal orifice. Next are the superficial perineal muscles, which are analogous to those in the male perineum. The bulbospongiosus muscles cover the bulbs of the vestibule and vestibular glands. Then ischiocavernosus muscles cover the crura of the clitoris, and finally the superficial transverse perineal muscles. The last structures in this pouch are the branches from the internal pudendal artery and pudendal nerve. Both the nerve and the artery give off an inferior rectal branch. The internal pudendal artery continues further and gives off a perineal branch, which supplies the bulb of the penis in males or the vestibule in females. The artery ends as the posterior scrotal artery or posterior labial artery. Like the artery, the internal pudendal nerve also gives off a perineal branch, which bifurcates into a deep perineal branch and a superficial perineal branch. This branch terminates as the posterior scrotal nerve or posterior labial nerve. Alright, now let's switch gears and discuss the deep perineal pouch, which lies between the pelvic diaphragm and the perineal membrane. This pouch is also bound laterally by the membrane that covers the obturator internus muscle, called the obturator fascia. Now, let's take a closer look at the contents of the deep perineal pouch. In males and females, this pouch contains the anterior extensions of the ischioanal fat pads and the urethra, which passes through the midline of the pouch. For males, it is the intermediate or membranous urethra that is within the deep perineal pouch. In both males and females, this part of the urethra is surrounded by the external urethral sphincter. In the female deep perineal pouch, there are two other smaller muscles that are actually part of the external urethral sphincter complex, called the compressor urethrae and the urethrovaginal sphincter. In males, there are the deep transverse perineal muscles. Traditionally, it has been described that females have a sheet-like deep transverse perineal muscle. However, the current understanding is that this is not the case. Instead, there is a mass of smooth muscle at the posterior edge of the perineal membrane. In males, the deep perineal pouch also contains the bulbourethral glands, which are a pair of pea-shaped glands that lie below the prostate gland. Finally, let's take a look at the neurovasculature within the deep perineal pouch. This pouch contains the internal pudendal artery, which bifurcates into the deep artery of the penis or clitoris, and the dorsal artery of the penis or the dorsal artery of the clitoris. The pudendal nerve also continues in this pouch and ends as the dorsal nerve of the penis or the dorsal nerve of the clitoris. The deep perineal nerve, a branch from the perineal nerve, supplies the muscles within the superficial and deep perineal pouches. Okay, now let's take a deep breath and have a quick quiz. Can you name these pouches? Now, let's switch gears and discuss the anal triangle, which contains the anal canal and anus, as well as a wedge-shaped space on each side of the anal canal called the ischioanal fossa. This fossa is filled with loose connective tissue and fat tissue. The ischioanal fossa is bounded medially by the external anal sphincter and the levator ani muscles, posteriorly by the gluteus maximus muscle and the sacrotuberous ligament, anteriorly by the pubic bones, and laterally by the ischium and the lower part of the obturator internus muscle. Speaking of the obturator internus muscle, it is covered by a membrane called the obturator fascia. This membrane forms a horizontal passageway called the pudendal or Alcock canal. This canal contains the pudendal nerve and the internal pudendal blood vessels, which enter the Alcock canal at the lesser sciatic foramen alongside the nerve to obturator internus. We've discussed the vessels that supply the perineum in different pieces, but let's put it all together now. Let's start with the internal pudendal blood vessels, which supply and drain blood to and from many structures in the perineum. In the Alcock canal, the internal pudendal artery gives off the inferior rectal artery. The inferior rectal artery passes medially to supply the external anal sphincter and the skin that surrounds the anus, called the perianal skin. Then, the internal pudendal artery gives off the perineal artery, which goes on to give off two branches, called the artery of the bulb of the penis or the artery of the vestibule, and the posterior scrotal or posterior labial branches. The artery of the bulb of the penis or vestibule supplies the bulb of the penis and the bulbourethral glands in males, and the bulb of the vestibule and the greater vestibular glands in females. The posterior scrotal branches or labial branches supply the skin of the scrotum or the skin of the labia majora. Finally, the internal pudendal artery enters the deep perineal pouch to give off its terminal branches, which are the deep artery of the penis in males and the deep artery of the clitoris in females. The deep artery of the penis or clitoris supplies most of the erectile tissues in the penis and the clitoris. The next terminal branches are the dorsal artery of the penis and the dorsal artery of the clitoris. The dorsal artery of the penis or the clitoris runs through the deep perineal pouch and supplies the dorsal surfaces of the penis and the dorsal surfaces of the clitoris. Now let's follow the course of the pudendal nerve, which has a similar course and branches as the internal pudendal artery. In the canal, the pudendal nerve gives off the inferior rectal nerve. At the end of the canal, the pudendal nerve bifurcates into the dorsal nerve of the penis or the clitoris and the perineal nerve. Let's start with the inferior rectal nerve, which runs with the inferior rectal artery to supply the external anal sphincter and the perianal skin. Next, the perineal nerve, which gives off two branches, the superficial perineal nerve and the deep perineal nerve. The superficial perineal nerve gives off the posterior scrotal nerves in males or the posterior labial nerves in females. Both lie in the superficial perineal pouch. These nerves run in the superficial fascia of the posterior scrotum or labia majora to supply the skin of the scrotum or the skin of the labia minora and majora. Next is the deep perineal nerve, which supplies muscles of the deep and superficial perineal pouches, the skin of the vestibule of the vagina, and the mucosa lining the lower part of the vagina. Finally, the dorsal nerves to the penis or the clitoris are the main sensory nerves that supply the penis and the clitoris. These nerves run with the dorsal artery, reaching the dorsal surfaces of the penis and the clitoris. Here, the nerves run lateral to the arteries, reaching the tip of the penis or the clitoris. Alright, as a quick recap, the perineum is a shallow chamber of the pelvis that lies inferior to the pelvic diaphragm. The perineum is divided into an anterior urogenital triangle and a posterior anal triangle, with the perineal body forming the center of the perineum. The urogenital triangle has two compartments called the superficial and deep perineal pouches. The superficial perineal pouch lies between the perineal membrane and the perineal fascia. The pouch contains the erectile bodies as well as their associated muscles, the greater vestibular glands in females, and the superficial transverse perineal muscles. The neurovascular structures in the superficial perineal pouch are the inferior rectal and the perineal artery and nerve. The perineal artery and nerve continue as the posterior labial or scrotal artery and nerve. The deep perineal pouch lies between the pelvic diaphragm and the perineal membrane. It contains the urethra and external urethral sphincter, as well as the deep transverse perineal muscles and bulbourethral glands in males, and the compressor urethrae, urethrovaginal sphincter, and smooth muscle in place of the deep transverse perineal muscle in females. The neurovascular structures in the deep perineal pouch are the internal pudendal artery, which bifurcates to give off the deep artery of the penis or clitoris, and the dorsal artery of the penis or clitoris, the pudendal nerve, which ends as the dorsal nerve of the penis or clitoris, and the deep perineal nerve. Finally is the ischioanal fossa, which lies on each side of the anal canal. On the lateral wall of this fossa lies the Alcock canal, which contains the internal pudendal blood vessels and the pudendal nerve.
The diamond-shaped perineum is divided into two triangles, the urogenital triangle anteriorly and the anal triangle posteriorly. The urogenital triangle differs between males and females. In males, it contains male external genitalia and the perineal muscles. Let's start with the male external genitalia, which includes the membranous, or intermediate urethra, the spongy urethra, the scrotum, and the penis. The membranous urethra begins at the inferior surface of the prostate gland, called the apex. Then it passes through the deep perineal pouch, which houses the deep perineal muscles, the deep transverse perineal muscles, and the external urethral sphincter. The deep transverse perineal muscle extends from the medial surface of the ischium to the perineal body. The external urethral sphincter is a circular muscle that surrounds the membranous part of the urethra and compresses it to maintain urinary continence. The deep perineal muscles are innervated by the deep branch of the perineal nerve. Now, in the deep perineal pouch, posterolateral to the membranous urethra, are a pair of P-shaped glands called the bulbourethral or Cowper glands. The ducts of these glands cross the deep perineal pouch with the membranous urethra and terminate by emptying into the proximal part of the spongy urethra. During sexual arousal, these glands secrete mucus-like secretion into the urethra. Finally, the membranous part of the urethra extends through the bulb of the penis, where it's continuous with the last part of the urethra, called the spongy urethra. The spongy urethra is located within the corpus spongiosum and extends through the penis to the external urethral orifice. The spongy urethra contains an expansion in the glans penis called the navicular fossa. Now, let's discuss the scrotum, which is a fibromuscular sac that lies postero-inferior to the penis and inferior to the pubic symphysis. The scrotum contains the testes and associated structures. The scrotum develops as two masses that approach each other and fuse in the midline, forming the scrotal raphe. The scrotal raphe is continuous anteriorly with the penile raphe on the ventral surface of the penis, and posteriorly with the perineal raphe in the midline of the perineum. Alright, now the arterial blood supply of the scrotum differs between the anterior and posterior surfaces. The anterior surface is supplied by the anterior scrotal arteries, which are the terminal branches of the deep external pudendal artery. The posterior surface is supplied by the posterior scrotal arteries, which are the terminal branches of the perineal arteries, which are branches of the internal pudendal arteries. Both the superficial external pudendal artery and the deep external pudendal artery anastomose with branches of the internal pudendal arteries and can also supply the skin of the penis. Finally, both surfaces of the scrotum receive arterial blood supply from the cremasteric arteries, which are branches of the inferior epigastric arteries. Next are the scrotal veins, which accompany the arteries and drain into the external pudendal veins. Finally, the innervation of the scrotum also differs between the anterior and posterior surfaces. The anterior surface of the scrotum is supplied by the anterior scrotal nerves, which arise from the ilioinguinal nerve. The anterior scrotum is also innervated by the genital branch of the genitofemoral nerve. The posterior surface is supplied by the posterior scrotal nerves, which arise from the superficial branch of the perineal nerve and the perineal branch of the posterior cutaneous nerve of the thigh. Okay, now let's take a deep breath and have a quick quiz. Can you name these structures? Additionally, can you name each of these 3 lines? Alright, now let's talk about the anatomy of the penis, which serves as a common passageway for semen during ejaculation and urine during micturition. In the anatomical position, the penis is erect, meaning the dorsal surface lies near the abdomen, and this means the ventral surface lies near the scrotum when it's flaccid. Within the penis are 3 bodies of erectile tissue, 2 paired corpora cavernosa, and a single corpus spongiosum. These erectile tissues are the main internal structures that compose the 3 parts of the penis, which are the root, the body, and the glands. Let's start with the root, which is the attached part of the penis. The root lies in the superficial perineal pouch and consists of 3 erectile structures called the bulb and the paired crura. The bulb of the penis lies in the midline and is the expanded proximal end of the corpus spongiosum. The posterior part of the bulb is penetrated superiorly by the membranous urethra, forming the spongy urethra. Finally, the bulb of the penis is covered by the bulbospongiosus muscles. The right and left crura lie on each side of the bulb and are the proximal tapered ends of the paired corpora cavernosa. The crura are covered by the ischiocavernosus muscles. Now, let's talk about the body of the penis, which is the free part of the penis hanging from the pubic symphysis. As the erectile tissues continue into the body of the penis, they form 3 columns. A single corpus spongiosum, which lies ventrally, and the paired corpora cavernosa, which lies dorsally. As we mentioned before, the corpus spongiosum contains the spongy urethra, which ends at the external urethral orifice, or urethral meatus, at the tip of the glans penis. The corpus spongiosum and the paired corpora cavernosa are covered by a continuation of deep perineal fascia, called the deep fascia of the penis or buck fascia. The corpora cavernosa are also covered by an extra layer of fibrous tissue called the tunica albuginea. Now, the corpus spongiosum courses through the body of the penis and expands distally, forming the glans penis. The lateral margins of the glans penis expand to cover the distal ends of the corpora cavernosa. These extensions are called the corona of the penis. The lower ends of the corona form a groove that connects the body of the glans penis called the neck of the penis. Here, the skin and fascia of the penis extend to form a double layer that partially covers the glans penis, called the prepuce or foreskin. This foreskin connects to the glans penis on the ventral surface of the penis by a median fold of skin called the frenulum of the prepuce. The foreskin can be removed in a small procedure called circumcision. Males that undergo this procedure are called circumcised males, while males that have the foreskin are called uncircumcised males. Alright, now all these erectile tissues are fixed by the ligaments of the penis, which support the root of the penis and attach it to the surrounding structures. There are two ligaments of the penis, the suspensory ligament and the fundiform ligament. Let's start with the suspensory ligament, which is a thickening of the deep fascia that anchors the erectile bodies of the penis to the anterior surface of the pubic symphysis. Next is the fundiform ligament, which is a condensation of collagen and elastic fibers that arises from the linea alba and surrounds the penis like a sling. Let's take a look at the arterial supply of the penis. The main arteries that supply the penis branch from the internal pudendal arteries. These branches include the dorsal arteries of the penis, the arteries of the bulb of the penis, and the deep arteries of the penis. Let's start with the dorsal arteries, which are paired arteries that run on the dorsal surface of the penis. Here, the arteries lie on each side of a vein called the deep dorsal vein of the penis, in a groove between the corpora cavernosa. These arteries supply the fibrous tissues surrounding the corpora cavernosa, the corpus spongiosum, the membranous urethra, the spongy urethra, and the skin of the penis. Next are the arteries of the bulb of the penis, which supply the bulb of the penis, the part of the spongy urethra within the bulb, and the bulbourethral glands. Next are deep arteries of the penis, which are paired arteries that run in the center of each corpus cavernosum. These arteries give small branches that supply blood to the spaces of the corpora cavernosa, called cavernous spaces. Filling up these spaces with blood causes the penis to become erect. In a flaccid penis, these branches coil up to restrict blood flow, forming the helicine arteries of the penis. Now, venous drainage of the penis is mainly by the deep and superficial dorsal veins of the penis. Let's start with the deep dorsal vein, which receives blood from the cavernous spaces and drains into a plexus of veins that surround the prostate, called the prostatic venous plexus. Next is the superficial dorsal vein, which receives blood from the skin and the subcutaneous tissue of the penis and drains it into the superficial external pudendal veins. Some venous blood may also drain into the internal pudendal veins. Alright, now let's discuss the innervation of the penis. The pudendal nerves, which arise from the anterior rami of S2 to S4, terminate as the dorsal nerves of the penis, which provide sensory and sympathetic innervation to the penis. They run lateral to the dorsal arteries on the dorsal surface of the penis and innervate the skin of the penis and glans penis. Parasympathetic fibers arise from the S2 to S4 spinal cord segments, but they pass through pelvic splanchnic nerves to the prostatic nerve plexus. Here, they form cavernous nerves, which innervate the helicine arteries of the penis. Finally, the anterior scrotal nerves, which are branches of the ilioinguinal nerves, supply the skin of the root of the penis. Okay, now let's take a deep breath and have a quick quiz. Can you name these erectile tissues? Alright, now can you name these arteries? Okay, now let's talk about the muscles that lie in the superficial pouch of the male urogenital triangle. These are the superficial transverse perineal, the bulbospongiosus, and the ischiocavernosus muscle. Let's start with the superficial transverse perineal muscles. The muscles originate from the internal surfaces of ischiopubic rami and ischial tuberosities and insert into a fibromuscular mass that lies in the middle of the perineum, called the perineal body. These muscles support and fix the perineal body, which in turn supports the pelvic viscera. Next are the bulbospongiosus muscles. They originate from the perineal body and each side of the median raphe that extends along the midline of the bulb of the penis. They wrap around the bulb of the penis to insert into the perineal membrane and the corpus spongiosum and corpora cavernosa. These muscles also support and fix the perineal body, which, as we said, supports the pelvic viscera. The contraction of the bulbospongiosus muscles pushes the residual urine or semen from the spongy urethra. Finally, they aid in erection of the penis by compressing the outflow of blood through the deep dorsal vein of the penis and by pushing blood through the body of the penis. Finally, there are the ischiocavernosus muscles, which also originate from the internal surfaces of the ischiopubic rami and ischial tuberosities. These muscles wrap around the crura to insert onto their medial and inferior aspects and onto the perineal membrane. They maintain erection by compressing the outflow of blood through veins and by pushing blood through the body of the penis. Finally, all of the superficial perineal pouch muscles are innervated by the deep branch of the perineal nerve. Alright, now let's switch gears and discuss the lymphatic drainage of the male external genitalia, starting with the lymphatic drainage of the membranous urethra, which goes with the lymphatic drainage of the cavernous bodies into the internal iliac lymph nodes. Next is the lymphatic drainage of the spongy urethra, which accompanies the lymphatic drainage of the glans penis into the deep inguinal lymph nodes, with some lymph vessels passing to the external iliac lymph nodes. Now, lymph from the scrotum and the skin of the penis, except for the glans, drains into the superficial inguinal lymph nodes. Finally, you may think that the lymphatic drainage of the testes is similar to the scrotum, right? Well, that's not the case. The testes develop in the abdomen, so their lymph drains into the lumbar and pre-aortic lymph nodes. Alright, now that we understand the anatomy of the penis, let's switch to physiology and discuss the male sexual response. The sexual response has 4 stages, called erection, emission, ejaculation, and remission. Let's start with erection, which happens when the male is erotically stimulated, causing activation of the parasympathetic nervous system. This stimulation causes 2 changes. First, it relaxes the helicine arteries, making them straighter, which allows more blood to pass into the cavernous spaces. Second, the bulbospongiosus and ischiocavernosus muscles also compress the veins that drain the cavernous spaces, which traps the blood in the cavernous spaces. With more blood coming in but very little blood leaving, the erectile tissues swell up, causing the penis to become larger and more rigid. Next stage is emission, which is a response to sympathetic stimulation. This stimulation causes each ductus deferens and the seminal vesicles to contract. This pushes seminal fluid into the prostatic urethra, where prostatic fluid is added. So now the stage is set for ejaculation. Ejaculation describes the process of expelling the seminal fluid from the urethra through the external urethral orifice. Ejaculation involves both sympathetic and parasympathetic innervation. Sympathetic fibers cause the internal urethral sphincter to contract, and parasympathetic fibers cause the urethral muscle to contract. Finally, the pudendal nerves cause the contraction of the bulbospongiosus muscles. After ejaculation, the penis gradually returns to its flaccid state in a process called remission. This process results from sympathetic stimulation, which causes the helicine arteries to contract and recoil, and relaxes the bulbospongiosus and ischiocavernosus muscles. These changes allow blood to empty from the cavernous spaces into the deep dorsal vein, and the penis finally returns to a flaccid state. Now, here's a study tip for you. The mnemonic point and shoot can help you remember that point, or initiating an erection, is parasympathetic, and shoot, or ejaculation, is sympathetic. Alright, as a quick recap, the male urogenital triangle houses the perineal muscles and the male external genitalia. These genitalia include the membranous and the spongy urethra, the scrotum, and the penis. The membranous urethra starts at the apex of the prostate gland and joins the spongy urethra, which runs through the corpus spongiosum, terminating at the external urethral orifice. These two parts of the urethra get their blood supply from branches of the dorsal arteries of the penis. Next up is the scrotum, which lies postero-inferior to the penis and has a line called the scrotal raphe on its midline, which is continuous with the penile and perineal raphes. The scrotum is supplied anteriorly by the anterior scrotal arteries and posteriorly by the posterior scrotal arteries and nerves. The scrotal veins drain into the external pudendal veins. Next is the penis, which has three parts called the root, the body, and the glands. The root contains three erectile structures: a single bulb, which is the proximal end of the corpus spongiosum, and the paired crura, which are the proximal ends of the corpora cavernosa. In the body of the penis, these erectile tissues form three columns with the single corpus spongiosum lying ventrally, surrounding the spongy urethra, and the paired corpora cavernosa lying dorsally. These erectile tissues house tiny spaces called cavernous spaces, which fill with blood during an erection. Finally, the corpus spongiosum extends distally to form the glans penis. There are two ligaments that support the bulb of the penis, called the suspensory and the fundiform ligaments. The arterial blood supply of the penis is mainly by branches of the internal pudendal artery, including the dorsal arteries of the penis, the arteries of the bulb of the penis, and the deep arteries of the penis. The male superficial perineal pouch houses three pairs of muscles: the superficial transverse perineal muscles, the bulbospongiosus muscles, and the ischiocavernosus muscles. Finally, the male sexual response has four stages, called erection, emission, ejaculation, and remission.
Anatomy is so much easier when we compartmentalize things. For this reason, the perineum can be divided into two triangles, the anterior urogenital triangle and the posterior anal triangle. The urogenital triangle can be further divided into a superficial pouch and a deep pouch by a layer of deep fascia called the perineal membrane. In females, the urogenital triangle houses the female external genitalia and the perineal muscles. Let's start with talking about the female external genitalia, also called the vulva, which includes the mons pubis, the paired labium majora, labium minora, and the clitoris. As well as deeper structures, the bulbs of the vestibule, the greater vestibular glands, and the lesser vestibular glands. The mons pubis is a rounded, fatty eminence that lies anterior to the pubic symphysis, pubic tubercles, and superior pubic rami. This eminence has a coarse pubic hair that grows after puberty. Now, from the mons pubis, two folds of skin called the labia majora arise and extend posteriorly towards the anus. These labia meet anteriorly to form the anterior commissure and posteriorly to form the posterior commissure. Also, the labia majora is the termination point of the round ligament of the uterus, which is the embryonic remnant of the gubernaculum in females. Alright, now the labia majora lie on each side of a central depression called the pudendal cleft, which houses the labia minora and the vestibule of the vagina. The labia minora are paired hairless folds of skin that contain spongy connective tissue, erectile tissue, and many blood vessels. These labia unite posteriorly to form a fold of skin called the frenulum of the labia minora, or the fourchette. Anteriorly, each labium divides into medial and lateral folds. The medial folds unite below the clitoris, forming a pointy extension called the frenulum of the clitoris. The lateral folds unite to form a fold of skin called the prepuce, or foreskin of the clitoris. This fold covers the clitoris, which is the main female erectile organ and counterpart to the penis in males. The clitoris has three parts, called the root, the body, and the glans clitoris. The root of the clitoris consists of two crura that attach to the inferior pubic rami and the perineal membrane deep to the labia. These crura consist of erectile tissue called the corpora cavernosa, which extends into the body at the angle of the clitoris. Up to this point, the clitoris seems pretty similar to the penis, right? Well, the glans clitoris, unlike the glans penis, doesn't have an external urethral opening. This means that the clitoris doesn't have a urinary function, and functions solely as an organ of sexual arousal. The glans clitoris is the most highly innervated portion of the clitoris, and the only portion that can be seen externally. Alright, now the labia minora surrounds an area called the vestibule of the vagina, where the orifices of the urethra and vagina and the ducts of the greater vestibular glands open. The urethra opens through the external urethral orifice, which lies posterior to the clitoris and anterior to the vaginal orifice. Lateral and deep to the vaginal orifice are the bulbs of the vestibule, which are paired, elongated masses of erectile tissue. A comparable structure in males is the bulb of the penis. These bulbs are covered inferiorly and laterally by the bulbospongiosus muscles, which we will discuss further in just a bit. Next are the greater vestibular glands, which are paired round glands that lie posterolateral to the vaginal orifice. These glands are also partially covered by the bulbospongiosus muscles. During sexual arousal, they secrete mucus into tiny ducts that open on each side of the vaginal orifice. Okay, now let's look at the blood supply and innervation of the vulva. Arterial blood supply of the vulva comes from the external and the internal pudendal arteries. These branches include the anterior labial arteries, which arise from the external pudendal artery to supply the anterior part of the labia majora. Next are the posterior labial arteries, which arise from the perineal artery, which is a branch of the internal pudendal artery. The posterior labial arteries supply the labia minora and the posterior part of the labia majora. Next are the labial veins, which drain the vulva. These veins then drain into the internal pudendal veins, which drain into the internal iliac veins. Finally, let's talk about the sensory innervation of the vulva. The mons pubis and the anterior part of the labia majora are innervated by the anterior labial nerves, which arise from the ilioinguinal nerve. The anterior labia majora are also innervated by the genital branch of the genitofemoral nerve. The posterior part of the labia majora and the labia minora are innervated by the posterior labial nerves, which arise from the superficial perineal nerve, which, in turn, is a branch of the pudendal nerve. Alright, now the blood supply and innervation of the clitoris is a bit special. The arterial blood supply comes mainly from branches of the internal pudendal arteries. These branches include the deep artery of the clitoris, which supplies the corpora cavernosa of the clitoris, and the dorsal artery of the clitoris, which runs on the dorsum of the clitoris to supply the glans clitoris. This artery accompanies the dorsal nerve of the clitoris, which innervates the clitoris, and the deep dorsal vein of the clitoris, which drains into the vesical plexus. Finally, during the excitement stage of the sexual response, the clitoris enlarges as it fills with blood, very similarly to the penis during an erection. Okay, now let's take a deep breath and have a quick quiz. Can you name the different parts of the clitoris? Alright, now the urogenital triangle also houses the perineal muscles, which are grouped into superficial and deep perineal muscles. The superficial perineal muscles include the bulbospongiosus, the ischiocavernosus, and the superficial transverse perineal muscles. These muscles lie in the superficial perineal pouch, which is superficial to the perineal membrane. Let's start with the superficial transverse perineal muscles, which originate from the internal surface of the ischiopubic rami and ischial tuberosities, and insert onto an irregular mass that lies in the middle of the perineum called the perineal body. These muscles fix the perineal body, which helps support the abdominopelvic viscera. Next are the bulbospongiosus muscles, which originate from the perineal body and wrap around the bulbs of the vestibule to insert into the pubic arch. These two muscles also anchor the perineal body, which supports the abdominopelvic viscera. They also constrict the vaginal orifice, compress the greater vestibular glands, which assists in releasing their secretions, and contributes to the erection of the clitoris. Lastly are the ischiocavernosus muscles, which originate from the ischiopubic rami and the ischial tuberosities, and surround the crura of the clitoris to insert into the inferior and medial sides of the crura. These muscles maintain the erection of the clitoris by compressing the veins that drain it. The superficial perineal muscles are innervated by the deep perineal nerve. Next are the deep perineal muscles, which lie deep to the perineal membrane in the deep perineal pouch. First, we have the external urethral sphincter, which surrounds the urethra and compresses it to maintain urinary continence. In the female deep perineal pouch, there are two other muscles that are actually part of the external urethral sphincter complex, called the compressor urethrae and the urethrovaginal sphincter. Finally, contrary to traditional descriptions, the current understanding is that females do not have a sheet-like deep transverse perineal muscle. In place of it, there is a massive smooth muscle at the posterior edge of the perineal membrane. The deep perineal muscles are innervated by the deep perineal nerve. Alright, now let's wrap this up by discussing the lymphatic drainage of the vulva. First, lymph from the skin of the perineum, the inferior aspect of the vagina, the vaginal orifice, and the vestibule drain into the superficial inguinal lymph nodes. Next, lymph from the clitoris and the anterior part of the labia minora drain into the deep inguinal lymph nodes or directly into the internal iliac lymph nodes. Finally, lymph from the urethra drains into the internal iliac or sacral lymph nodes. Alright, as a quick recap, the mons pubis is a rounded elevation that lies anterior to the pubic symphysis. The labia majora surround the pudendal cleft, which houses the labia minora and the vestibule. The clitoris has three parts, called the root, the body, and the glands. The vestibule of the vagina is the area between the labia minora where the urethral and vaginal orifices open. Deep and lateral to the vaginal opening, there are paired, elongated masses of erectile tissue called the bulbs of the vestibule. The arterial blood supply of the vulva comes from the anterior labial arteries and the posterior labial arteries. Sensory innervation of the vulva is provided primarily by the anterior labial nerves and posterior labial nerves. The arteries of the clitoris include the deep artery of the clitoris and the dorsal artery of the clitoris, while the main sensory nerve of the clitoris is the dorsal nerve of the clitoris. And the venous drainage is by the deep dorsal vein of the clitoris. Finally, the superficial perineal muscles include the bulbospongiosus, ischiocavernosus, and superficial transverse perineal muscles. Deep perineal muscles include the external urethral sphincter, the compressor urethrae, the urethrovaginal sphincter, and smooth muscle in place of the deep transverse perineal muscle.